Hello, I'm Michelle Glaze, Director of Professional Outreach for the Foundation Fighting Blindness, global leader in driving retinal degenerative disease research. During this webinar, you'll learn about patient resources as well as the My Retina Tracker no-cost genetic testing program. For more than 50 years, the Foundation Fighting Blindness has been driving research to find treatments and cures for blinding retinal diseases like retinitis pigmentosa, Stargardt disease, and even age-related macular degeneration. As an eye care professional, through the Foundation's resources, you can provide knowledge, community, and hope to patients and families as they go through their personal journeys with vision loss. The Foundation website, www.fightingblindness.org, is a great place to gather information about clinical research underway, genetic testing, and local chapters and events. On the site, you'll find links to articles, educational videos, a clinical trial pipeline, the Eye on the Cure podcast, and information about upcoming virtual and in-person events. The Foundation also has a web page specifically for professionals serving the blind and low vision community. A link to that page can be found at the top right-hand corner of fightingblindness.org. The link is titled Eye Care Professionals. Community is vitally important for individuals with vision loss due to a retinal degenerative disease, and the Foundation provides a number of ways for individuals to connect with others in their local communities through our chapter network. The Foundation has volunteer-led chapters in metropolitan areas all over the U.S. and beyond. The chapters serve as an opportunity for individuals to get involved with local events, learn about resources in their community, and also learn about clinical research underway in the field. With nearly 50 clinical trials underway for inherited retinal conditions in a variety of different therapeutic modalities, there is a lot to be optimistic for in the future for patients with a retinal degenerative disease. There are also some FDA-approved therapies available for patients with wet AMD and dry AMD, in addition to Luxturna, which is an FDA-approved therapy for patients with mutations in the gene RPE65, commonly causing LCA or retinitis pigmentosa. By connecting your patients to the Foundation Fighting Blindness, you can help them find hope for the future and help them to learn about all of the clinical trials underway and the research being done to find treatments and cures for blinding diseases. When providing care for a patient with an inherited retinal disease, genetic testing and genetic counseling are both important components. The American Academy of Ophthalmology states that genetic testing is essential in the care and management of a patient with an inherited retinal disease. As many inherited retinal conditions can look alike clinically, genetic testing can help confirm a clinical diagnosis. It can also help for patients to better understand inheritance patterns and risk factors for other family members. Genetic testing is also important for patients who are interested in clinical trial involvement or FDA-approved therapies. The Foundation Fighting Blindness offers a no-cost genetic testing and no-cost genetic counseling program called the My Retina Tracker program. The My Retina Tracker program is a partnership between Prevention Genetics, Informed DNA, and the Foundation Fighting Blindness. The My Retina Tracker program is open to all patients in the United States who have been clinically diagnosed with an inherited retinal disease, as long as they haven't received testing with the panel of more than 32 genes in the last 5 years. The My Retina Tracker program offers a holistic approach to genetic testing. It enables patients to confirm a clinical diagnosis, as well as better manage their inherited retinal condition. It also helps the Foundation Fighting Blindness continue to drive the mission to find treatments and cures for blinding retinal diseases. Prevention Genetics offers a curated 110 gene panel targeting more than 97% of genes identified in solved cases through the My Retina Tracker program. For information about how to register to offer genetic testing through Prevention Genetics, please contact coordinator at myretinatracker.org. Informed DNA is our partner offering no-cost genetic counseling. Informed DNA counselors are very well versed in the inherited retinal diseases. They are very thorough and patient-centric. Informed DNA uses a telemedicine approach to consultations, and more than 90% of physicians utilizing the My Retina Tracker program do leverage the expertise of Informed DNA genetic counselors. Genetic counseling is important to help patients understand their genetic test results and is a mandatory component of the My Retina Tracker program. As a provider, you may elect to utilize your own genetic counselor. However, any expenses incurred to the patient would not be covered by the Foundation Fighting Blindness. When a genetic test is ordered through the My Retina Tracker program, a patient will automatically be placed in the My Retina Tracker registry. The registry is a global database that's open to all patients who have been clinically diagnosed with an inherited retinal disease. It is free, it is secure, and it is HIPAA compliant. The registry creates an opportunity for researchers and biotech companies to find and potentially recruit patients for clinical trials. It also helps researchers to study and better understand inherited retinal conditions, while enabling the foundation to continue to drive the mission to find treatments and cures. All information in the My Retina Tracker registry is confidential. No patient data is shared or disseminated to third parties unless de-identified. For more information about the My Retina Tracker registry, please visit www.myretinatracker.org. As an eye care professional, you are the guiding light for providing a path forward for your patients with an inherited retinal disease. It's vital that these patients see a medical professional who understands inherited retinal conditions. It's also essential for this patient population to obtain genetic testing and genetic counseling. Refer your patients to low vision and rehabilitation professionals who can help them to continue to live and thrive independently by providing resources that allow them to adapt to vision loss in all sorts of different settings, including home and work environments. With a multitude of emerging therapies and clinical trials underway, you can feel confident in communicating hope and optimism for the future to your patients with a retinal degenerative disease. To connect your patients with the Foundation Fighting Blindness or to learn more, please email us at po@fightingblindness.org. This is Michelle Glaze, Director of Professional Outreach. Thank you for your time and interest in the Foundation. Have a great day.